All right. Hello, everyone, and welcome to the What's Your Everest podcast. My name is Liam Hubbard. I'm an intern here at Everest Strong Coaching, and I am thrilled to be co hosting today with my co host, Dr. Carla Steingraber,
Good
who is a
morning.
licensed and clinical, good morning, a licensed clinical and sports psychologist who has been in practice for nearly 20 years and a certified mental game coach as well as an author. Her practice, Everest Strong Coaching, is housed in Northbrook, and she meets with clients both in person and virtually. And today I am excited to welcome our guest, Dan Wilsea, a certified mental performance consultant and a licensed mental health provider. Dan serves as a staff therapist at the Family Institute at Northwestern University, and his work is at the intersection of exercise science, sports psychology, and mental health. He also co-leads the exercise and sports psychology for mental health lab with Dr. Michelle Kouroulis, a fellow therapist at the Family Institute. And the lab is designed to promote the mental and physical benefits of movement through education and outreach. And Dan is a respected professional in his field and all around wonderful human being. So, Dan, thank you so much for coming on the show. We're so grateful to have you.
Yeah,
No,
welcome, Dan.
thank you so much. I appreciate that intro, and I'm really looking forward to the conversation.
Wonderful. Well, we would love to hear about what inspired you to pursue your career in mental performance. Was there a specific moment, a person, or experience that initially drew you toward the field?
Wow, man, what a great question off the bat. I think there's nothing that like stands out as like a one sort of thing. I think a lot of it comes from just my enjoyment in participating in competitive and recreational sports, as well as being a lifelong sort of physical activity seeker and exerciser.
Mm.
And then really like thinking about the mental performance side and becoming a consultant was that just idea of so much physical work is focused on that the missing piece I think is that mental side, and so being able to sort of bridge that is something that I really enjoy doing every day.
Was it something in your own athletic background that alerted you to the mental side of performance psychology?
Oh yeah, I think certainly being a competitive soccer player, there were certain times where I noticed myself being a little bit too sort of like amped up or keyed up in certain moments, and so I was like always wanting to pursue the field of psychology. I was like, there's got to be something behind that, and so it's been tremendous to sort of think about my experiences and be able to use some of those to really highlight the work that I do now.
You know, the mental side of sport, even though it's getting a lot more acknowledgement today, it's something that people kind of left off for a long time. What about it felt most meaningful or aligned to you and who you are?
I think the biggest part of it is just the fact that everyone is experiencing or could benefit from the mental performance side of a certified mental performance consultant, whether it's sport specific, exercise, or just in any other sort of like performance sort of vein, whether that's you know business wise or school wise. I think that really for me is one of the driving points of it's just performance psychology, and we always any one of us can benefit better with just that little bit 1% performance
Yeah,
improvement from day to day.
yeah, that's so true.
And Dan, something I'm really interested to know is what made you want to become trained in clinical psychology and sports psychology?
Yeah, I think at the start of my sort of clinical psychology journey, I didn't realize sports psychology was a thing, right? Full disclosure, right? I've had my degree in clinical psychology with a counseling specialization since 2009. So I feel like, you know, sports psychology was just a little baby or perhaps an infant or a toddler at that point in time, and so it really wasn't something that I knew a whole lot about. Because when I started out, I worked inpatient psychiatry in hospital settings, so with the severely or chronically mentally ill or patients who were experiencing some sort of crisis. So I was sort of on one end of the spectrum,
Mhm.
and while I enjoy that space, I realized that not a lot of people get better. And for me, being a lifelong sort of sports player, exerciser, I was like, I think I need to take my talents to a different realm. And so then I started working, right, like with the worried well, and and becoming a certified personal trainer through the American College of Sports Medicine. That's when I really started to combine like the psychology work that I was doing, and taking it to a different population. So like using goal setting and motivational interviewing to sort of cue my training clients to improve their outcomes. And then I was like, hmm, this seems like it's a thing. And so I started doing more research, and at that time, a few years later down the road, sports psychology was really becoming more of a talked about thing, a recognized thing. And so that was sort of how I found myself walking down the path to figure out, what do you do? How do you become sort of like trained in sports psychology? What else do I need to do? And and yeah, that was sort of how I found my fit.
Yeah, that's really cool. And something that I've always been very curious about with people who are dual trained like you in clinical and sports
Mhm.
psychology, how do you approach a case where an athlete initially comes in for a performance issue, but a clinical issue emerges during your work together? Walk us through what happens then.
I think such a great question, right? And such a relevant question to the field related to, right, like what sort of is the primary and what sort of is secondary. I think specifically to your piece, right? If someone's coming in for a performance related concern, but I notice some underlying more clinical or subclinical issue, is I'm gonna start to focus on that. And I will use a lot of measurement informed care and diagnostics and assessment tools in my practice, whether it's on the clinical side or the performance side. And so I'll, go through a clinical sport sort of intake beforehand with people to obtain like that presenting problem, right? Their sport and their treatment history, biopsychosocial elements, and give them some measures. USOPC has a really good one out now that they're using, the SMAT, which is like a really great screening tool. I'll use the PHQ-9, the GAD-7.
Hi, everyone. What's your Everest? We all have a mountain we're trying to climb. My book here, What's Your Everest? How to Win in Sports, Career, and Life While Enjoying the Ascent, is here to help you with your journey to the top while enjoying the climb. It's written for both teens and adults who are looking to grow, push themselves, and believe bigger. It's available on Amazon. And if you find this book is helpful to you, even with one step up the mountain, I'd truly be grateful for your review. Keep climbing. You've got this.
Give a really good, robust overall sort of view. And then, right, if we do have to do some of like that clinical focus, reduction of anxiety, improvement of like depressive episode, that's where I'll focus, because a lot of the time, right, as we get them to be more emotionally regulated or reduce that stress or increase their behavioral sort of activation to get them out of that depressive episode, that that tends to alleviate some of that baseline performance degradation.
Mhm.
Um,
Oh, that totally makes sense.
Are you ever finding that within the same session, the two different modes are integrated, or do you keep it more separate?
oh yeah, I certainly try to integrate whenever possible. Um, I think a lot of the work crosses over in that sense of being able to really apply, and especially with a lot of the student athletes that I see, right, where the idea of like I'll use the sport specific piece kind of to highlight maybe an area of emotional regulation improvement, or a little bit more on that side of like time management, scheduling, in that sense of like, how can we maybe improve this outcome related to practice, something that you're going to every day, right? We try some of these kind of little little tidbits, little elements, and then how does that, or where can you improve that throughout like your homework hierarchy, right? Or studying, right? Where can you practice some of those things besides just having it be, okay, today we're going to focus on the sport, and then next week we're going to focus on the clinical issue. But the idea of being able to blend it in session and use both as kind of like a mirror, I think
Mm,
really works well. And like I said, especially with the student athlete population that I see.
Now, I've certainly run into some D1 athletes who know that they're struggling with something, but they don't realize that it would be something like anxiety. Like they can't imagine
Mhm.
that they have performance anxiety because they've been performing so long,
Mhm.
essentially. How do you explain that integrated approach to athletes who may only be expecting performance enhancement?
I think that's where the measures come in really handy, right? And
Mm,
being able to have or implement some of those baseline measures, maybe in the first session, as you're going through like the treatment history or the biopsychosocial interview, being able to get that baseline screaming and then sort of say like, here's some of the things that I noticed, whether it's in that same session or in the next session, being able to look really at and say, you know, here's this range. And that's what I like about the SMAT is it's looking at, you know, anxiety, depression, sleep, nutrition, um, as well as a few other things if they pop sort of like positive or scream higher. And so I think just having that tool along with being able to communicate with them and going through that sort of intake interview and being like, here's some of the things that I noticed, right? What do you think about that? And really
mm,
opening up the conversation because I think to your point, Carla, right, is like there are so many high functioning athletes who
mm.
have perhaps an underlying piece of stress or anxiety that if we alleviated that, they might find their sport a bit more enjoyable or being able
Yeah.
to take their performance just a bit higher than what it is. Yeah, so such a great question.
What about, do you find there ever situations where the separation is essential? That you're working only on the clinical piece or only on the performance piece?
Yeah. I mean, I think there are certain cases, right, where I think about like the severity of the clinical presentation is high enough and maybe the insight into it is low, right? Where an athlete might not necessarily connect the dots of this depressive episode or this really like big anxiety spike is what maybe is driving their performance decrease. And so those are the times where right I'll really hone in on we're just going to work on the clinical side of it and they really are kind of focused on like well I just want to do the performance work. I'll weave sort of the clinical elements in to some of the examples but really like hone in on okay so you want to increase right your mental strategies or your pre-performance routine ahead of your cross country meet. Sure. Let's think about what can we do, right? Where does that routine start? And then those are the times where I'll try to pull out some of the pieces of like, well, now that you're seeing success in that routine, where else could it be useful?
yeah.
Yeah, I mean, that's a really important piece because performance psychology has really come out of psychology, right?
Mhm.
So, um, we feel stress, anxiety, pressure from a variety of situations, and being able to stay calm under pressure, regardless of what's going on, is relevant, right? So,
Yeah.
yeah. What about your therapeutic modalities? Are there any in particular that you favor in your clinical work? How do those overlap with performance consulting, or are there particular techniques that you favor for high performers?
I mean, I think certainly I'm very much a CBT sort of oriented clinician. That's usually my sort of frontline treatment modality, CBT. Um, However, I love an eclectic sort of pulling and sampling. A lot of mindfulness. Um, I use a lot of ACT as well as some DBT skills in my clinical sort of day to day. But certainly like leaning in heavy on the CBT side.
We had such a good time speaking with Dan today, learning about his path in the world of sports psychology and some of the techniques that he uses with his athletes. Stay tuned for part two, where we're going to dive deeper into the conversation with Dan about the topic of performance anxiety.